It's Nicole Gonzalez. I hope you're having a good day so far. So today I'm going to be talking about my project, which was stress, sleep, and its effects on academic performance on first and second year medical students. So a little bit of background about this. First, defining what medical school is. So medical school is basically a professional school with a curriculum that leads to a medical degree. So many of the prerequisites that come with this include a high school diploma, just a college undergraduate diploma usually most of the times, and also you have to take the medical college admissions test. So all of these are components that are prerequisites for getting into medical school. So once you get into medical school, your diploma will lead you to a license to practice medicine as a doctor. And most medical schools are around 4 years, and the first 2 years are mostly spent in laboratories and classrooms, and you mostly spend your time studying health-related topics and science-related topics. And then in years 3 and 4, you begin to work in a hospital or a clinic under the supervision of a more experienced physician. And then after that, you go on to your residency, maybe a fellowship, and then you practice doctors. But for this project, I focused on first and second year medical school because simply put, medical school is very difficult, especially in the first 2 years, getting used to everything. Many people report that those 2 years, since they're so academically focused, they tend to be the most taxing for medical school students. And some common things that are noted is just achieving balance in your life between your social life and sleep and doing well in school, also the memorization that comes with it, having to basically fit, whole textbooks in your head, and then the pressure to do well. You have to make sure that you are passing these classes or else your diploma or your medical school degree might be compromised. And then just the pressure to not fail and crack, because what you're learning is very, important in saving other people's lives. So just those aspects of medical school make it very difficult and taxing. And the effects of medical school are seen according to a literature-reviewed journal of clinical sleep medicine. Sleep disturbances are a lot higher in medical students than non-medical students, and this becomes a prevalent problem. So this leads me to my research question, which is what is the effect of stress and sleep disturbances of first and second year medical students on academic performance? So going into this, stress and sleep disturbances I predicted were two very important variables that affected academic performance. And I chose to focus this on first and second year medical students because I believe that, studies show that these years are normally harder than the third and fourth years, which third and fourth years normally focus on clinical aspects and actually working with patients, whereas first and second year, you're normally taking more tests, you're completing more studies. So this is why I chose to focus on first and second year medical students. So I wanted to see how these variables can affect academic performance. So my goal was to just relate and define these effects, and I have a personal investment because I may be going to med school in the future. So, and it's also important to define these relationships to see how they can be improved and possibly save lives. So I believe that those are very important reasons why I felt the need to just research this further. So the way I gather my information is I used Google Scholar, but also mainly University of Florida's library catalog because they have this one search engine that you can input exactly what you're looking for. So I was definitely looking on focus studies, secondary reviews, cross-sectional studies, just information that is either focused in one specific medical school or several medical schools that were pulled together information, just because I wanted to get more either generalizable results or I wanted that qualitative and quantitative data. I wanted to make sure I get a well-rounded picture of the scenario and the relationships that are going on here. So yeah, I just wanted to make sure that there were some multi-school studies which gathered information from several medical schools and put them together, or just studies focused in one area. So this is how I gathered. I also looked up key terms such as medical students, sleep, stress, medical school, academic performance. Some other ones were first and second year medical students, the effects of stress, on academic performance. I also tried looking up more specifically like standardized test scores, but I think because of confidentiality, I couldn't exactly get those, so I had to settle with just academic performance because of that confidentiality issue with standardized testing, such as a USMLE Step 1 and Step 2, which is very common tests taken by these medical school students. As for my findings, I found that sleep disturbances are a large-scale problem in medical school. However, sleeping patterns are not technically a predictor of academic success or failure, meaning that although sleep is a huge problem in medical school and sleep disturbances have been proven to be a problem in medical school, academic success or failure is not necessarily correlated with this. However, the people who researched this noticed that one limitation was the use of other external variables such as attention-enhancing drugs, such as Adderall, that maybe will affect the outcome, or maybe did affect the outcome. So they recommended that in future studies that these variables be controlled, because these possibly did affect the outcome of the study. Second is that academic performance on tests does influence stress instead of the reverse relationship. And I thought this was interesting because I predicted that it was stress that influenced academic performance. However, in this study, they found that academic performance on tests influenced stress. And the way they did this is that they had a study that measured students' levels of stress and academic performance before and during med school. And they found that, again, grade influences stress in that direction. And that, their personality or their level of stress did not personally influence academic performance as I once thought. And the amount of stress that they have regardless due to their academic performance does have severe outcomes, and we're going to get into that in just a second. This graph here of the finding that is of prevalence rates for probable mild and moderate depression. So as you can see, of medical students, first and second year medical students have the highest rate of around 8 to 9%, and then you can see the statistic starts to drop in the third and fourth year, going from 7% to 2%. So this is very important, noting that first and second year students have a lot higher stress, and now you can kind of make that correlation to academic performance causing this stress. Another interesting statistic is that the sleep quality of medical students in first and second years on the left-hand side of the screen. That graph shows the sleep quality, and you can see that first and second year medical school students have a lot lower sleep quality than third and fourth and fifth and sixth years. And this affects their daytime dysfunction. As you can see, first and second year students have a lot higher prevalence of daytime dysfunction than third and fourth and fifth and sixth years. So these two can be directly correlated. The lack of sleep causes the prevalence of daytime dysfunction. So my conclusion, or what is basically that there needs to be interventions of coping mechanisms that help reduce stress. And by coping mechanisms, I mean not influencing academic performance, but however, after the student receives their test grade or after the outcome, they're able to deal properly with that outcome and not overstress or not, get depressed because of it. So I think that interventions to reducing stress and increasing sleep in medical students may definitely help in their overall well-being. And this is extremely important because medicine is a very high-risk practice, in that the doctors and physicians need to be keen and alert at all times. So it's very important that what they're learning to their fullest extent, and they know how to deal with negative and positive outcomes. And it was showed that on one study in coping mechanisms, they had an 8-week stress reduction intervention course for medical students, and they did meditation and yoga, and they practiced just basically stress-reducing mechanisms. And the study found that the intervention could reduce anxiety and reduce psychological stress and increase empathy. However, this study could not predict the outcome of long-term needed. stress reduction methods. So I think that's something that's very important to further look into. It's good to know that for the time being it's helpful, but I think we need long-term methods, and we need to discover new techniques that will also increase the mental and physical wellness of medical school students, because the fact that 6% of students had suicidal ideations, and that there was a large and 83% are stressed and 21% had probable depression is a large disproportionate amount of people, and I think this really needs to be improved. So finding new research approaches, advancing research to reduce stress and increase sleep in medical students will be a great way to figure this out. So I would like to thank you for listening to my presentation, and if you have any questions, you can email me at heyitsnick@ufl.edu. Here are my image credits.